Hello doctors, have a beautiful day. Today we are looking at the intravenous cannulae and the color coding. So firstly, the 14G. The 14G, the color coding is orange and the flow rate is about 270 ml per minute. So it is a large volume. So this is done in case of the trauma patients as well as the rapid and large volume replacement. So in such cases, it is administered. Next, if you look moving ahead, 14G we have seen, now 16G. So 16G, it indicates it is gray in color. So here it is slightly less, that is 236 ml per minute. So this is also again used in case of the trauma patients. It is used in case of major surgeries, as well as it is used in the intrapartum and the postpartum, used in case of the GI bleeds, as well as the multiple blood transfers, as well as the high volume of the fluids. Next, moving on, we look at the 17G. The 17G, if we see, it is white in color. So here the rate is almost half, that is 125 ml per minute. And other thing to note is that it is newly added. Next, moving on to the 18G. 18G is green. 18G is green and it is about 100 ml per minute. And it is used basically for the blood products as well as the delivery of the irritant meds, as well as it is used in case of the major surgeries and contrast studies. So contrast studies, you have green, that is nothing but the 18 gauge. Next, we are looking at pink. So in case of the pink, it is 20G. 20G is pink and it transfers about 67 ml per minute. It is used for the general IV maintenance, as well as the IV antibiotics can be administered with the 20G and the IV analgesics. Next, we are looking at the 22G. So the 22G is nothing but it is blue in color. It transfers about 42 ml per minute and it is small, fragile veins, and the cytotoxic therapy it is used. Next comes the very important, it is 24G. Why is it important? Because it is yellow and it transfers 20 ml per minute and it is only used in case of the pediatric. This is important. Next comes the 26G. So 26G is a violet and it transfers, it has a flow rate of about 13 ml per minute. And other important thing to note is that it is newly added.